And good evening or good morning, depending on where you are when you're listening to this right now. Welcome to another edition of Bloomberg Opinion Editorial Board Conversations. I'm your host, Robert George, and I am incredibly pleased to welcome the newest member of the Bloomberg Opinion Editorial Board, my new colleague, Clara Ferreira Marques, who is talking to me right now from our Singapore office. So, Clara, welcome to the board. Welcome to Conversations.
Thank you.
Yeah, great. The death rate on COVID in the U.S. right now is around 615,000, and there was actually a disturbing story that ran on the wires today that in some places, in some of the more red states, they are misreporting actual cause of death, and you've been doing some great reporting that. The death counts range widely across the globe, and I think you've raised the issue that we need to get more accuracy on death counts. So could you explain kind of the issue and where some of the biggest problems are?
Sure. So I think what you're looking at in the US is really a small example of a much bigger problem. So in the US, we have had mislabeling, so willful or otherwise, politically motivated or otherwise. But writ large, we have this globally. And what that means is that 18 months into the pandemic, we actually really can't put our finger on the number of people that have died of COVID-19. And that's for a variety of reasons. It might be, well, in large part, it's because of how complicated COVID-19 is, how difficult it is to distinguish underlying conditions from complications with the disease, very difficult to pinpoint exactly what has caused the death ultimately. And it's also at a very basic level because of the poor death registration, and in particular, poor cause of death registration. And what that means is that it's very difficult for us to keep track of where the peaks are, where the troughs are, where we're seeing variants that are particularly lethal. And in order to think about the policy fixes, we really need to understand that a lot better, and not just in the developing world, but in general. This is not, as we know, a national problem. It's very much a global problem.
One proxy on analyzing death from COVID has just been looking at excess deaths in a country or a region. Why is that inaccurate, and what is the problem with just looking at the excess death numbers?
There's a lot that's right about excess deaths. So excess deaths has come up a lot in COVID because of partly what I mentioned. It's very difficult to pinpoint exactly what is a COVID death. There are political reasons that in some countries have muddied the waters, not least in parts of the US. And excess deaths just looks at, statistically speaking, it's just the number of deaths above the trend, above the historic trend, above what we would have expected. And it is actually a really important number, but we need to know what it represents. It represents all deaths. And that is really important in a pandemic because that will count COVID deaths, but it also counts all the other deaths that occur in a pandemic that are indirectly caused by COVID. So, for example, undiagnosed cancers, pregnancies that are complicated and people are unable to reach hospitals, say, in India because of lockdowns, suicides, mental health problems, drug abuse that might come from the economic strain associated with the pandemic. So excess deaths are really important because they do give us a picture of the overall toll. We just need to understand exactly what it measures. It doesn't only measure COVID-19 deaths. It is and has been a really good indicator of where there is official undercounting, though. And that has been very important. And that's particularly been the case in India, for example, but also Russia. Mexico is a good example of that. And to a degree, even in the US, especially in the early days of the pandemic.
Why is it so necessary to get that accurate count? I mean, obviously, on an individual basis, every death is a tragedy, and obviously, loved ones are going to would like to know about why their loved one died. But why is it necessary in the big picture to get as accurate a number as possible?
So it's a long-term thing. It's not just something we need as a result of COVID-19. We need generally to understand what people are dying from and where. COVID-19 has just made it a lot more urgent, and it makes it a lot more urgent for our systems to be resilient. So resilient in times of crisis and also timely, because if we don't have that information immediately, it's not very helpful. We won't know where the peaks are. We won't know where the problems are. And policymakers with the best will in the world cannot implement the right policies. They can't also target the populations that are the most affected. The reason we need it more generally is just because if we know what people are dying of, we know how to keep them alive. We know, for example, I mean, take the excess deaths example. If we know that people are dying not of COVID-19, but, for example, of deaths associated with economic strain or of undiagnosed cancers, then there are policies that we can put in place in order to stop that. These are really important issues. Globally, obviously, the UN has been working on this for some time, not just death registration, but birth registration. And as you say, it's a moral issue. Every life counts. But it's also an issue of just, it's an issue of understanding what we're dealing with at a very basic level.
I think your reporting has indicated that India, in particular, which, as we know, has been racked by COVID in the most recent wave and in an awful manner. Their official toll is somewhere around 420,000, but most outside observers think that number is completely way off. When we were talking a little bit before we started here, you said that that bad data leads to bad policy. What has been the impact of India getting its death rate numbers wrong or inaccurate as of right now?
Well, that's right. India is a really good example of where bad data has led to bad decisions. And during the first wave of COVID, there was a narrative espoused by the government, but also more widely, that India was resilient. India had dealt with COVID, that the fatality rates were so low that actually this wasn't going to be a problem for the country, or it wasn't a problem on the scale, certainly, that had initially been anticipated. It bred a lot of complacency, which then obviously resulted in an absolutely dramatic and devastating second wave. What we do know is that a lot of that data that was coming out initially was just wrong. There was weak surveillance. So really, really simple things like comparing two states, like comparing Bihar, which is a relatively poor populous state in the north, with Chhattisgarh a little bit further south, would show that these states are not so different, and yet their fatality rates were completely different. And because the fatalities were small, but the infection numbers were based on seroprevalence surveys, which tend to produce much larger numbers, you have this fraction that makes absolutely no sense at all. So it's very difficult to make people take steps towards protecting themselves, to make people see the urgency if the fatality rate is minuscule and the numbers are massively undercounted. And to give you a sense, I mean, the estimates range incredibly widely, but I think one of the most credible ones will come from Brahma Mukherjee at the University of Michigan. She counts at about 2.5 million, so 5 times larger than the official death count. Excess deaths, however, go almost up to 5 million, so a much, much higher number.
Are we getting it more or less right in the West, or are these is the bad? I hate to put it this way, but is the bad death data kind of a global problem?
Obviously, it is better in the West, and it's better in the West because we tend to have online or digitalized death registration. But we did see during especially at the peak of the pandemic in Europe and elsewhere, that civil registrations were not a priority and were disrupted. And this wasn't the case across the developing world, for example. So there were places in the developing world where civil registrations continued. And what that meant is that we did have big differences between excess deaths and COVID deaths, for example, in the UK. In the US, I think New York City probably had one of the biggest gaps early on, if you remember. And there were parts of the world where, reasonably developed systems where there were also political motivations to keep the numbers down. And I think Russia, Mexico would be good examples of that. So it isn't just an emerging market problem. It's just that it's a lot graver in the emerging markets. And it's because it's not just about the difficulty of pinpointing that this death was a COVID death. It's that in general, you aren't counting deaths at all. So in Africa is, as you might expect, the place where we have the patchiest data, and that goes from South Africa to close to 90%, Botswana about 80%, and Niger at something like 3%. So the breadth, the patchiness of this data is enormous. And if you're only registering 3% of your deaths or 2.5% as in Guinea, there is no way you can know where your problems are. And there are many ways around that, and perhaps we can talk about that. There are many ways that we can rather than just saying, okay, well, we need to fix the civil registration problem. Yes, obviously we need to fix it. But civil registration is a reflection of state capacity. So if state capacity isn't there, it's not something you can fix overnight. There are, however, other things we can do to improve the monitoring. And this becomes so important as we head into this long tail of COVID-19, where we really will be, as a global community, we will have to keep a very close eye on where these flare-ups are occurring and why.
So it's fair to say that as in many other situations, the pandemic is exposing what had been an underlying, if underreported, problem in many of these nations before. Because obviously, in possibly many parts of Africa, as you said, deaths were not being accurately recorded pre-COVID, and now it's just being more exposed now.
That's exactly right, and it's the timeliness issue. I mean, to be fair, as we've said before, this is also a developed country problem. I mean, in the US, all you need to do is look at Hurricane Katrina, look at Hurricane Maria, where death tolls were used for political purposes and kept down for political purposes, and it has been really difficult to pinpoint the exact number of people. So yes, it's not only a developing market problem, it's just a much bigger problem where you have absolutely no set of data to go on. So, for example, even calculating excess deaths becomes impossible when you haven't got an underlying trend line, you haven't got that baseline. So what the world needs to work on now is really figuring out, how can we get around that? How can we, as we wait for big rollouts of digital systems, which are, possible. We've all got smartphones. Smartphones are incredibly cheap, even in places like India, parts of Africa. They can be rolled out as a sort of means of very quickly connecting practitioners, doctors, and community leaders, because a lot of these deaths are happening outside hospitals. So you really need elders, village leaders to be using their phones to connect, immediately register the birth, register the death, connect it back to where it's collected and then used by government. But while we wait for that, there are other methods we can use, and that includes things like verbal autopsies, where you do household surveys that aim to have use a sample of the population to get a sense of where the death rates are, or things like seroprevalence surveys that measure the rates of infection, and then you sort of calculate from there how many of those people you think will have died, and you compare the two.
So, are there third parties that can aid in tracking this down? I mean, is the World Health Organization or the UN, are they lending any of their skills to some of these nations to try and get these numbers more accurate, or are there other third party charities that can also aid in this?
Absolutely. It's been a big priority for the UN, well before the pandemic. It's one of the development goals that we're supposed to be working towards. And the WHO has, exhaustive lists, for example, for verbal autopsies, what they should include. They've been really clear on what the definition of a COVID death is. It's just that hasn't always been applied. It does require funding. But where efforts have been made, and our very own Bloomberg Philanthropies is involved with some of these, we have seen great success. So Peru is a good example, a place where Bloomberg is involved, where we have seen the digital records have made a really big difference. South Africa, another one where intervention has made a dramatic difference.
And by the way, we say that in service of transparency, not to promote just one of our sister organizations. So are we looking at as we finish up here? Is the, speaking of transparency, is the transparency on the global death rate, can we look at in a positive manner, or is this going to be a lagging issue for months, if not years, to come?
Well, unfortunately, it will be. I'm sure there are many lagging issues that will come out of COVID, many hidden costs and hidden losses. But this one is certainly one that was there before, has been exposed, and I am sure will be dealt with far greater attention than in the past, not least because it's entirely in the self-interest of the developed world. We need to know where these variants are happening. We need to know where they are lethal. And we need to know where there are capacity issues. So I'm confident that we will see a greater focus And the progress that we've made over the last few years and decades leads me to believe, to be reasonably optimistic, just that there are a lot of things that will demand our attention after the pandemic. This is unfortunately just one of them.
And on that note, I guess basically, hopefully, we'll take in some of these lessons and hopefully do, tragically say, hopefully we'll get it even more accurate in time for the next pandemic, which unfortunately is probably right around the corner. Clara Ferreira Marques, my brand new colleague, thank you so much for your time, and thank all of you. We'll be talking with you again next.